Good morning, everyone. This is Anna Johnson from John Burton Advocates for Youth. We are going to start our webinar in just a few minutes. We're seeing that folks are logging on now, and so just hang tight for about 1 or 2 minutes. Thank you. Good morning, everyone. This is Anna Johnson from John Burton Advocates for Youth. Thank you so much for joining us this morning for our webinar, SB 89, Implementation in the Bay Area, What Can We Learn as a State? So just as folks are still logging on, I want to go over some logistics with you that will help. Today's webinar is really focused on giving you all the materials and resources that you need to both understand the law, SB 89, and how to implement it, and all of the available materials. So if you can go ahead and take these beginning moments to download the handouts that you can find in the control panel, that would be great. Also, we want to take some time at the end of today's presentation to answer your questions. So you can also type your questions into the panel during any time of the presentation today, and we will go through and answer those questions for you. And then finally, at the end of the presentation, we will have this recorded, and all of our presentation materials will be able to be found on our website using this link. So this morning, we actually have a number of presenters. Myself, I'll be presenting some of just the agenda, the background behind the law, and also some of the resources and recommendations that we have for implementation of SB 89. We also have Carolyn Howe, who did a lot of the research and interviews that led to the report that we'll be talking about later. Alexis Berries, who is an advocate who helped pass the law and have this put into place. And we also have an expert here from Alameda County, who is the director of the Foster and Kinship Care Education at Chabot College, who's going to share some of their ongoing training practices that they have for resource families. And today's agenda, we're going to cover a number of things. First, we're going to talk about the impetus for the law. Why did we need SB 89, the reproductive and sexual health disparities for youth in the foster care system. We're going to learn about the perspectives from our subject matter expert who has lived experience in the system and has helped advocate to pass these laws. We're then going to go sort of piece by piece into the different provisions of the California Foster Youth Sexual Health Education Act, what it means, what that looks like. And then Carolyn is going to be sharing the findings from her study and talking about counties, how they've handled the law, what are they doing to implement it, what progress have they made. We'll highlight resources that are out there for counties and caseworkers and managers, probation officers to use, and we'll provide recommendations that we believe will help improve outcomes for youth in care around their sexual and reproductive health. So starting with some of these disparities that led to the passage of SB 89. First, over the last few decades, California has built a pretty impressive network of sexual and reproductive health information and services that are intended to address the needs of adolescents, which can include mandatory comprehensive sexual health education, which is required to be provided once in middle school and once in high school. We have clear consent rights that allow adolescents to access care confidentially. We have clinics that are trained to address teenage needs, several public funding streams that ensure sexual and reproductive health services can be accessed for free. They have trustworthy information for teens and caregivers and providers that have been vetted both by young people and the medical professionals who know the kind of content expertise. And so as a result of all of this work in California, this network of services and programs have been effective in reducing teenage pregnancy rates across our state. Even nationwide, we're at historic lows across the country, with California leading the charge along with Massachusetts and Connecticut, with the largest % reductions in pregnancy for teens overall. Unfortunately, that downward trend that we're seeing nationwide and in California in teen pregnancy rates is not reflected when we're looking into outcomes for youth and young adults in the foster care system. In fact, almost half of the youth in foster care in California will have been pregnant at least once by age 19, and that rate is more than double the rate of people who are not in the foster care system, so compared to their peers, which was part of the impetus for this law. So of the youth in care that did get pregnant, 2/3 said that the pregnancy was not intended, which leads us to question what is getting sort of in the way of young people in foster care from living their sexual and reproductive reality that they see for themselves and their lived experience. So when someone gets has an unplanned pregnancy, that can set up additional barriers for the youth in terms of their educational attainment, their economic stability, and their potential for multi-generational involvement in the child welfare system. And so again, this was sort of part of what we were looking at for the impetus for the law. And so we also have taken a look at birth outcomes. So for the general population, a study in 2010 at least, the majority of pregnancy to adolescent females aged 15 to 19 in the United States, an estimated 60% ended in a live birth, with 15% ending in a miscarriage and 30% ending in abortion. These are not, of course, what we're seeing is a disparity here for youth in the foster care system, with higher rates of stillbirth, miscarriage, and lower rates of access to prenatal care. So once a choice has been made to continue with a pregnancy, young people, despite having access, free services, are not getting that prenatal care that could help them have a healthy live birth. So we're seeing disparities again. We also have seen disparities in looking at sexually transmitted infections, with higher rates and reporting of STIs by age 26 among youth in care compared to their peers. So again, knowing that young people are not operating in a vacuum, that they're not different from their peers, that there's something going on with our system, with our environment in foster care that is creating these unique barriers for young people around their sexual and reproductive health rights and access. And when we see this big difference between these different groups, it can be helpful to see what some of the systemic barriers that exist have influenced their access to sexual and reproductive health care and have created these health risks for young people. So for youth in foster care, there are a number of issues that are unique to them that make it particularly difficult to access care and information. For instance, young people in foster care often experience changes in housing and school placements, and those changes may make it hard to access sex ed in schools. Placements that youth live in may impose rules that make it difficult to get to a clinic. They might have been refused services or transportation in a timely manner. And lastly, social workers, caregivers, probation officers have noted that maybe they don't know what to say, they haven't had training, or they weren't sure if they were allowed to provide information or what was a trustworthy resource, which has led to the avoidance of important conversations around sexual and reproductive health care overall. So as part of a collective impact initiative called the Los Angeles Reproductive Health Equity Project that John Burton Advocates for Youth is a part of, we're working to improve the sexual and reproductive health education and service access for young people. And we work to pass this legislation to tackle the barriers that we've just talked about and to improve outcomes for youth around their sexual and reproductive health care and improve sexual health equity. In 2017, we passed SB 89, known as the California Foster Youth Sexual Health Education Act, and it requires critical training for social workers, probation officers, caregivers on healthy sexual development. The bill also helps ensure that youth in foster care receive comprehensive sexual health education that's available to all California students, once in middle school and once in high school. And if they weren't able to get that because of placement changes, moving or entering into care, that education be provided through an alternative source. And then there are also, the law regulates changes that clarify sexual and reproductive health care as part of a necessary medical care and clarifies duties and responsibilities of workers with youth to inform youth of their sexual and reproductive health rights and to work to remove any barriers to ensure those rights are upheld and that they have access to the care that they need. So a little bit more about the passage of this law. We actually have a subject matter expert with lived experience on the phone who's going to speak with you. Alexis Berries is an advocate at John Burton Advocates for Youth, and in her role here, she advocates for policies to improve the lives of foster youth, homeless youth, and youth involved in the juvenile probation system. Alexis was formerly in foster care and was part of the first cohort of youth to participate in extended foster care to age 21. She is a full-time student and a service provider with Uplift Family Services, providing behavioral and mental health services. And in September of 2018, Alexis was appointed by Governor Jerry Brown to the Homeless Coordinating and Financing Council. So I'm going to hand it over to Alexis, who's going to share more with you about the impetus for the law, how it was passed, and the legislative process that led to this change. Thank you, Alexis.
Hi, thank you, Anna. Good morning, everybody. I want to apologize for any background noise that you may hear. So my name is Alexis Berries, former foster youth and current advocate with JBay. After spending a total of 18 years in the foster care system with a focus on stabilizing my placement, a notable gap was around my health, specifically my sexual reproductive health. The reality of this is not unique to me. A lot of youth lack the same treatment. This is and was a big deal because it caused an alarming amount of unintended pregnancies. According to the National Campaign to Prevent Teen and Unplanned Pregnancy, more than half of young women in foster care in California will have been pregnant at least once by the age 19, a rate that is 3 times greater than for non-foster youth. Not surprisingly, this leads to early childhood bearing. A University of Southern California study found that 35% of young women who were in foster care at the age of 18 gave birth by the age of 21. Again, at the rate that is more than double the rate of non-foster youth. It's worse in Sacramento County, where 37% of young women in foster care will have given birth by the age of 21. So for me and others who experienced foster care, education came second to finding a bed to rest our heads at night. During my time in care, I moved placements over 8 times and changed schools at least 6. What that meant for me was that I was either behind or ahead academically, mostly behind. This caused me to miss out on a lot, including sexual health education that most teens get in school. California law requires students to receive sex education once in middle school and once in high school. For most, that didn't happen because of the changes of schools and placement. When I missed school from all the placement changes, I was never able to make up that curriculum. In addition to that, I had no idea where to access information besides the internet. And we all know that everything you read on the internet isn't reliable or true. A lot of what I learned was inaccurate, and not one of the 7 social workers I had during my time in foster care attempted to talk about my sexual reproductive health with me. The biggest issue was with being placed in different households is that each foster family has its own cultural beliefs. In several placements, my foster parents prohibited any conversations around sex and didn't allow us to access any birth control. Group homes of CRTPs, they would also oftentimes compensate birth control, disallowing us to practice safe sex and intercourse. This was a clear violation of our rights. But what are you supposed to do as a teenager that doesn't know any differently? I didn't have an unintended pregnancy, but my older sister did. I have seen firsthand the challenges that she faced. She was unemployed and moved from shelter to shelter with her young child. Sadly, studies show that most foster kids who have children will not participate in higher education, and their children are more likely to enter the foster care system due to maltreatment. As an advocate, I worked alongside JBay to bring these concerns to the legislature to consider a proposal to invest $2.8 million in a program to prevent unintended pregnancies by promoting foster kids with comprehensive sexual education, helping enforce our reproductive rights, and training child welfare professionals. The budget proposal would require that social workers track foster kids' education to make sure they receive comprehensive sex education. Second, the budget proposal would ensure that youth are informed of their rights to sexual and reproductive health. And finally, the proposal would include training for all child welfare personnel, including caregivers and social workers. So the question really is, how do child welfare professionals and caregivers play a role in this? And what can they do to support young people? Well, I think it would have helped me the most. I think what would have helped me the most would have been having constant communication with a supportive adult in my life, whether it be caretaker, counselor, social worker, because the nature of the conversation, I recognize it can be hard to engage with young people, but if this is the case, you can also link them to those who are qualified specialists who can divulge that information and they can receive accurate information. I think conversation is detrimental to the success of this implementation. Young people need supportive adults in their life that they can trust and that is able to communicate with them. And you can be just that.
Okay, thank you so much, Alexis. And to folks listening and who just heard about that advocacy that led to the passage of the law and sort of what we think can make the difference in youth sexual and reproductive health outcomes, go ahead and type in some questions into the control panel and we can start to think about those responses and prepare our answers for you. So feel free to take a moment there. And Alexis, thank you again so much for everything you did to help pass this into law, to get funding through the budget, and to make these resources available to social workers, professionals working with youth, and to young people and caregivers themselves. So thank you. Okay, so now, as I see some of the questions rolling in, thank you. I want to turn it over to my colleague, Carolyn Howe, who is the Senior Project Associate here at John Burton Advocates for Youth. And in her role, she's managed several projects related to our policy and technical assistance work. Most recently, she's managed various projects focused on providing resources to help with local SB 89 implementation efforts, such as the development of a pre-approval curriculum, which we'll talk about later, use fact sheets, which we have linked into this PowerPoint, and a guide for case managers to have sexual health conversations. I'll turn it over to her to talk about the publication that was just released today, to go over the findings from her work and interviews, the best practices and challenges to SB 89 implementation.
Great, thanks, Anna. So now, for the past years, John Burton Advocates for Youth has partnered with a number of stakeholders through the Los Angeles Reproductive Health Equity Project for foster youth to really identify obstacles and develop approaches to improve the sexual and reproductive health care or health of youth in care, with a particular focus in Los Angeles County, but then also bringing that to the broader scope of the state, including advocating for policies which ultimately led to SB 89. So now it's been a little over 2 years since SB 89 has went into effect, and so we wanted to see how the policy has been implemented around in our area, the Bay Area. And so with the generous support of Tipping Point, we've gathered information from 5 Bay Area counties and published a report today that lays out those findings and recommendations. The link to access the report can be found on the slide there, and it is also one of the handouts that you can download in your control panel. So the 5 Bay Area counties we focused on were Alameda, San Francisco, Solano, Santa Clara, and Contra Costa. So during the summer and the fall of this year, we conducted a series of interviews with child welfare and justice system representatives, as well as community partners within those 5 counties. Those interviewed included county social workers, their supervisors, probation officers, judges, caregiver trainers, public health nurses, attorneys, and others. The interviews focused on progress of implementation, so whether policies and procedures have been updated to align with the provisions of SB 89. We also looked to identify promising practices and also challenges that might have surfaced during local implementation efforts. And ultimately from that, we developed some recommendations that we think we would further facilitate implementation efforts. Now, before we proceed to the findings of the report, I just wanted to acknowledge and thank the child welfare and justice system professionals who provided information and their perspectives on the implementation progress in their respective counties to really make this report possible. The organizations we interviewed are listed on the slide there, and I just wanted to say, thank you again for investing your time with us to help inform statewide learning on SB 89 implementation. So how we structured the report was breaking it down by looking at the progress of implementing individual provisions of SB 89. And actually in your control panel, there's also, in the handout section, there's also a SB 89 fact sheet that outlines the provisions for the policy. The first one that we focused on was the training provision. So it requires critical training for child welfare professionals and foster caregivers that include the following topics. So the reproductive and sexual health rates of youth in care, the duties of caregivers and case managers related to those rights, how to document SB 89 related information in the case plan, how to engage with youth about their sexual and reproductive health, and information about contraception methods and additional resources for service referrals. And who needs to be trained on this topic? County social workers and probation officers, judges, resource families during pre-approval and short-term residential therapeutic programs, and group home administrators during certification training. So from our interviews, we found the greatest clarity and implementation progress around the training mandates of SB 89. Representatives from all counties had updated or were in the final stages of implementing training curricula with the required SB 89 topics for either the resource family pre-approval training or for their training for social workers. 3 county representatives noted that their agencies had updated their resource family pre-approval curriculum, and 4 had updated their social worker training to cover the SB 89 topics already by the time I was interviewing them. The remaining counties were in the process of piloting curricula and had rolled out scheduled with the latest scheduled for January 2020. And under SB 89, the California Department of Social Services was tasked with developing curriculum on supporting healthy sexual development for youth in foster care. And so as a result, CDSS released an 8-hour curriculum for in-person training in April 2019, and they provided it to the 4 regional training communities who deliver the curriculum quarterly. Additionally, the curriculum was made available for public use, and in July 2019, they also released a 2-hour online version of an SB 89 curriculum that covers those mandated topics. And so through our interviews, we found that representatives from 4 out of the 5 counties noted that they were using one form of the state curricula, which kind of emphasizes that, state resources, help facilitate implementation progress. So we asked county representatives to rate how effective the policy of incorporating the SB 89 topics into training was. For training for social workers, the average score was 3.4, with 5 being very effective. Many expressed the importance of social workers having a good knowledge base around sexual and reproductive health responsibilities and communicated the high prevalence of issues in this area of health in their counties. However, some expressed the need for more guidance around the case documentation provisions, which we'll talk a little bit more about later, including, how and where to document SB 89 related information. There's also discussion of, low attendance rate as being a factor in their rating. For incorporating the topics into resource family pre-approval training, we got the average score of 4.4. Many representatives emphasized the importance of making resource families aware of their duties and responsibilities around sexual and reproductive health early on. So families can really assess and evaluate their responsibilities and ability to uphold them. Some problems or barriers that came up with implementation was, the inadequacy in the visibility, awareness, and prioritization of sexual and reproductive health issues for youth in foster care. When we asked, whether SB 89 was an effective step towards reducing some of those sexual and reproductive health disparities among youth in care, all representatives from all counties believed it was a step in the right direction. However, they expressed a stronger desire for stronger communication and more guidance from management at both the county and state level in order to emphasize the urgency of preventing unplanned pregnancies and improving overall practices and policies related to the overall sexual and reproductive health of youth in care. Representatives from multiple counties compared SB 89 implementation efforts to recent statewide efforts to curb overprescription of psychotropic medication for youth in care, pointing out that sexual health and reproductive health is not as highly visible as the issue of psychotropic medication. Another county representative further supported this notion, kept sort of underscoring that right now sexual and reproductive health is currently seen as an optional, and there needs to be more support from upper management to kind of make it more of a mandatory effort. That county representative also added, it takes a village and everyone from the top to bottom needs to understand the importance of this. So she also suggested, additional training for people who also touch the child welfare system, such as defense attorneys or ILP coordinators or THP Plus and MD programs. We also found that child welfare agencies and probation departments are typically implementing SB 89 policy independently, leading to duplicate efforts or the loss of opportunities to learn from each other. We also found that the representatives from most counties didn't know the status of implementation for SB 89 training when it came to foster family agencies and STRTPs. FFAs are responsible for training the resource families that come through their organization, and this is often independently from the county. And so representatives from all the 5 counties noted that they don't provide oversight into ensuring FFAs in their county have incorporated the required SB 89 topics in their resource family pre-approval training. And most of them were not aware of whether the FFAs in their counties had done so. For SDRTPs, as of July 2019, there were 32 licensed SDRTPs or transitioning group homes in the 5 counties that we looked at. Now remember, SB 89 requires that SDRTP administrators be trained on the SB 89 training topics during certification training. As a result of continuing of care reform, existing group homes transitioning to our STRTP did not need to receive the new administrative certification training where the SB 89 training mandate is in. Instead, a special category of training was established for existing group home administrators who wish to become recertified as SPRTP administrator. And that 12-hour long training didn't include the SB 89 training mandate. And lastly, not lastly, even with the training mandates in place, resources noted the need for more awareness of, existing accessible free resources related to sexual and reproductive health. And Anna will talk a little bit more about that later. Another common barrier to the training implementation that was discussed was, the short time frame of pre-approval training. There's many topics that need to be covered in pre-approval training, and as more required topics get added onto the list over time, it becomes more difficult to cover the topics effectively and in a useful and meaningful way for resource families. Representatives from all counties noted that it was difficult to incorporate the new yet sensitive topics within the limited time constraints, but we did have 2 counties note that they did extend pre-approval training by 2 or more hours to accommodate the SB 89 topics. Another problem area that came to light was many counties' training was structured for new resource families that were going through the approval processes or newly hired social workers. So while all counties have or will be incorporating their updated curriculum soon, most curriculum was implemented, just recently. So there's going to be a gap in who receives SB 89 training, specifically, with existing resource families that were already approved and the existing social workers already hired. Some counties offered spot trainings, but, with staff changes or, resource families that were already approved, it may be hard to fill that gap in training. In most of the counties, representatives estimated maybe less than 50% of their social workers or resource families have received the SB 89 training. 2 counties, however, have discussed implementing SB 89 training beyond the SB 89 mandate. And actually today we have Dr. Raspberry here to speak a little bit more about that in our county spotlight on Alameda County. Dr. Raspberry is the director at the Foster and Kinship Care Education Program at Chabot College. She has over 16 years within the FKC program. Specifically, her work and educational experiences have focused on organizational management, educational change leadership, and training development. Thanks for being on the webinar with us today.
Good morning, everybody.
Good morning. So Alameda is one of the counties that has decided to provide SB 89 training for resource families that goes beyond the SB 89 mandates. Can you tell me more about what Alameda does and sort of the thinking that went behind that?
Yes, so we currently have a 2-hour training that is ongoing, and we started with listening to our resource family. We discovered as a part of working with them, we did actually a pilot. So we had a pilot training last June, and then we did another training in September, and we do plan on having a training at our Family Health Symposium in February. But what we discovered in the feedback from the participants in June and September was that families were, of course, very supportive, and they want their kids to be safe and to be healthy and to protect them from dangers such as teen pregnancy or dangers related to health around their sexuality. But what kept coming up was they didn't feel, meaning the resource parents, didn't feel comfortable in utilizing language to talk with them. So things like, how do I begin a conversation? How do I engage them? And if I, in fact, as an adult, have difficulties talking about things that are related to sexuality because of the way I was raised, how do I begin? So part of the the implementation was centered around finding ways to allow the resource parents to feel a level of comfort through communication. So things like we had a very good facilitator with a background in maternal child health and also working with teens. So one of the things that she did was develop an icebreaker that was centered around coding that adolescents use. So for example, coding like they might be texting with a friend and a parent will come in the room and they have code to say parent around or parent in the room. Or they use icons to express things of a sexual nature. So one of the things that the resource parents all could pretty much agree on was that we want to keep them safe, we want to have an awareness, but also I need to find language that's going to allow me to begin to have a conversation. And through the trainings for the pilot, that was done with about 35 foster parents, and it was done at the Foster Parent Association. The second training was with trainers, and it included social workers at varying degrees of experience. And there was also some other community groups that were involved. So one of the things we learned and we had to work with was we had to, first of all, develop some sort of beginning communication that care providers would be readily willing to use. And so that's where we are at this present date, that we are supporting the resource families. We know that there will be continued trainings, and actually Alameda County has been doing a pretty good job of being supportive. The one other area that I would say that we need to work on a little bit more, and that is when we roll out our RFA pre-license training, we have currently the 12 hours. So when we looked at that, we couldn't see how we could fit it in. So one of the suggestions that came up, and that's still ongoing, but one of the suggestions that came up and we decided, okay, let's try that. And that is they will refer to SB 89 within the training in this form of a memo that they would need to sign off on, but from the RFF training that there would be, that anyone who attended RFA training, pre-licensing, and those that are seasoned resource parents that need continuing ed hours, that they would be mandated through Alameda County, that the new folks would be given the training, they would be on a path. So, for example, they go through their 12 hours of training and then eventually, but pretty quickly, they would be registered into the mandatory SB 89 training. That's for all new ones. The other ones also, meaning the tenured resource parents, would also be required. One of the ways of tracking that is we thought about the framework of like orientation. So perhaps in the fiscal year we would offer 3 to 4 trainings where they would be assigned, just like they come in through the process of the pre-service licensing training for the RFA class. They would be registered in through the social workers team, and they would know that they would have 3 to 4 opportunities in the year to attend the mandated training. So that's the part of the implementation understanding that we just settled out on, and we're working through that. So as a result of that, we do have a family health symposium, and the afternoon of that day is dedicated to SB 89, and we'll be moving forward from that. So one of the things that I can share about feedback from trainees was that they appreciated the having some language to talk to their children about, and they also was asking if they had if they needed help where they got stuck, who could they reach out to? And so part of that was the link with their social workers and if the social workers as a whole, because currently social workers can say, well, I have this family or several families, they need this training or they need to go back to a training for this. So that was another opportunity that, okay, if we discover after going through the training, the resource parents are saying that they're struggling, they can come back through and we can try to identify those specific areas that that family or families are struggling with. And that's how we're working through it right now. So it is ongoing training, an ongoing training effort, as well as the partnership between Chabot College and the County of Alameda is going to require mandated training for all the resource families in the county.
Great. Thank you again, for really providing some insight into, what Alameda County is doing around training their resource family in this very important topic. We really, really, really appreciate you being on the webinar today.
You're welcome.
Thank you. Now, with that, turn it back to Anna to discuss some resources around training and go into the recommendations.
I'm sorry, Carol.
Thank you again.
Okay, moving on.
Oh,
okay,
go ahead, Dr. Raspberry.
No, I thought I may have misheard you, but I see. I understand now.
Of course. No, thank you so much. And everyone who is listening in, if you have questions for Dr. Raspberry, feel free to type them into the questions box in the control panel, and we will answer those. I've already gotten some questions, and I'll be going through those now. But a lot of the questions have to do with, where can I find this information? How can I have these conversations? Where's the link for that? So I'm looking at the question panel here, and I'm going to get into that now. So for each provision in SB 89, there are free vetted materials that have been developed with experts, both from the medical field, advocates, lawyers, and young people themselves who have created these and disseminated them. So we're going to kind of talk through these trustworthy resources that everyone's sort of saying, I don't want to Google it, I don't want to guess it, I want something that's reliable. So here's a number of resources with links in this presentation. So again, just a reminder, you can download this presentation from the handout section of the control panel and then easily access all of these links and resources that I'm going to be talking about. So the first resource I'd like to highlight that has to do with training is that actually there is a classroom curriculum provided by CalSWEC through some of the budget that Alexis was talking about that was passed with this law has helped to provide trainings and resources and materials for this specific use. So using this link, you can have a classroom curriculum. That entire curriculum can be downloaded and used. The PowerPoints, the handouts are all available. If you have a local trainer in your county who wants to do this, if you want to borrow it for something else, it is all here for social workers, probation officers, and others. You can sign up to take these classroom trainings as well through CalSWEC. So that is that resource. They've also created an online resource. So if you have new staff, new folks who want like a quick tutorial, maybe they missed it, by a day, maybe they were sick on training day, whatever that reason is, maybe they're rural, maybe they can't get there, who knows? But we have online video tutorials as well that can talk you through some of these basic concepts, show you how to have these conversations, show you how to enter even things that are really technical, like what are my duties as a social worker or probation officer? How can I enter this into the case plan? So if you see those kind of links, they will walk you through that with those video tutorials. They'll walk you through how to find those resources for contraception, safe sex, and their certificates for completion and credit for that training as well. So, this is a resource that can be disseminated and provided or written into policies to say, for any new hire, we're going to do this, and then send them to the classroom curriculum. Another training and resource materials that I really want to point out, because it's kind of everything all in one place, is that the California Department of Social Services websites, which are linked here, through their Healthy Sexual Development Work Group, which had members from across the state weigh in, all of the all-county information notices that talk about how to document, trainings, resources, the materials around healthy sexual development and pregnancy prevention for youth and foster care in different language. So some are in English and Spanish. There was a specific question earlier by a person in the panel that, what are the disparities for youth who identify as lesbian, gay, bisexual, transgender, and actually, this link right here has a PowerPoint in English and Spanish with some of that information and that talks about those different disparities and risks. It's also in Spanish. There are some Vietnamese, Tagalog, and other language materials linked on here too. So if you have those populations that you're serving, we get a lot of questions to our email saying, can you send me the youth rights brochure? Can you send me the training link? These are your links, so bookmark them, tag them, and spend some time getting to know it, or also reach out to us and we'll send you these links as well. On our John Burton Advocates for Youth website, we do have a curriculum to train resource families. That curriculum is available in English and Spanish. You can download the PowerPoint slides and the presentation. There's a pre-test and post-test. And again, with that Know Your Rights youth brochure, which everyone's asking, what can I post? What can I hand out? What's reliable? Here again is another resource and exactly where you can find it that fits this SB 89 training curriculum provision. So knowing that there are these free resources in mind, knowing that we have this Healthy Sexual Development Work Group at the Department of Social Services, we really want to see the department in their role of oversight work with that work group and with the child welfare directors to issue, and disseminate that comprehensive guidance about the need for SB 89 implementation, which covers these training requirements, the funding that's available in the localities to provide these trainings, the resources and materials, sort of like what we've done today. There could be more technical assistance provided on a regular basis to help counties understand these provisions and to implement the law using these resources. We'd like to see counties and the state communicate through these designated contacts. So the Healthy Sexual Development Work Group does have an email that you can email to get technical assistance, get information, and you can also email us and we'll direct you there as well. And we'd also like to see an annual report published talking about how are we doing, is SB 89 having the impact that it was intended to have? How are the sexual and reproductive health outcomes of youth today versus when this law was passed? We also recommend that counties work to update their training protocols using these resources that are trustworthy, with a plan for both training new and existing social workers, like Dr. Raspberry mentioned, that Alameda County is doing, that SDRTPs that might have already been going through that different license, that those administrators do have knowledge about this law and the resources and come into compliance with that non-minor dependent transitional housing program providers and other staff serving youth in care like CASAs, dependency attorneys, ILP coordinators all have these resources. So we're hoping counties can use this information and disseminate it out through their networks. Additionally, to caregivers and professionals to post on their websites the available trainings, materials, and resources so that people have that question answered about what can I use, what can I do, and to provide advanced or extended training offerings to professionals and caregivers serving youth ages 10 and older who really need this information and in a timely manner. So again, having a county point person who can oversee the implementation, since there are different provisions, different resources, someone who can sort of hold that centralized knowledge, we believe would help implement and come into compliance with this law at a faster pace. And finally, the legislature in their role of oversight and in their role of parent to children that have been taken into state custody, we really believe that they could do more to look at SB 89 implementation to see how the funding is being used, if that is sufficient, and to help address the barriers that folks have come up with so far and see, you know, what do we still need as far as accessing services.
Great. So now on to the second provision of SB 89. SB 89 requires the case management worker, so this includes both probation officers and social workers, to review the case plan of youth ages 10 and older annually, and indicate that they have verified that the youth have received comprehensive sexual health education that meets the standards of the California Healthy Youth Act, once in middle school and once in high school. And if they find that the youth has missed it, then they have to document in the case plan how they will ensure the youth receives the missed instruction. So this provision builds upon the existing law, the California Healthy Youth Act, also known as CHIA, which went into effect in 2016. CHIA requires that all public and also now charter schools to provide comprehensive sexual health education once in middle school and once in high school. And it sets some pretty rigorous standards of what the curriculum must include. For the full requirements, you can click on the bottom at the slide. But, you know, some things include, you know, the curriculum has to affirmatively recognize that people have different sexual health orientations, and that abstinence may not be discussed in isolation. It has to be age appropriate and medically accurate and objective. You know, school districts are meeting this mandate in a variety of ways. There's not just like one curriculum that they can plug in. There's different curricula out there and materials. They also offer it in different grades and classes. And so it does present a little bit of some challenges, which I'll talk a little bit about later. But overall, you know, due to placement changes and school instability, you know, foster youth may often miss the course when comprehensive sexual health education is offered. Alexis talked a little bit about that in her experiences earlier. And what, you know, SB 89 does is it puts in a checking point or a system to really ensure that, you know, foster youth receive the CHIA compliant comprehensive sexual health education that they're already supposed to get in school through this broader piece of legislation. So what do we find in terms of the implementation progress of this provision? Representatives from 3 counties noted that they had updated their policies and procedures to specify that verification and documentation of youth receipt is a mandate. No one really discussed issues with entering it into CWS CMS system, but overall, this case plan documentation, oversight of this documentation is unclear, and it seems that, you know, compliance and implementation progress is largely dependent on, you know, the supervisor's oversight and direction. Through interviews, county representatives revealed varying degrees of understanding of the comprehensive sexual health education case planning provision. One common misconception was that informing youth of their sexual health rights and talking to youth about their rights was the same as receiving comprehensive sexual health education. That is not the case. Comprehensive sexual health education, you know, that complies with the standards of CHIA is pretty extensive, and it typically will be delivered over several days or weeks in school with trained professionals and experts. So it's, you know, definitely more than just a conversation about a youth sexual health rights, and just, you know, providing resources to get them information that they may need. Another common misconception was that verification of comprehensive sexual health education can be done through a student's self-report. That's also not the case. there needs to be, some sort of verification either through a transcript or attendance list or, contacting the school directly. There was also confusion on, what the mandate is if, the student is eligible to graduate under the minimum state requirements. And, they may not need to take that class that, the sex ed is provided in. But, regardless, it is still the responsibility of the Child Welfare Agency and Probation Department to ensure that the youth receive it once in middle school and once in high school, whether it is in school or it's through a different avenue, like in a community-based setting. CDSS updated CWS CMS to enable this sort of documentation of comprehensive sexual health receipt in a youth case plan. These system updates went into effect January 2019, and an informational bulletin was released in December 2018 outlining the upcoming updates. But it seems like there's little awareness and guidance on the use of new modifications. And there's also, CDSS has also provided guidance on several of the SB 89 provisions. There's been a lot of publications, ACLs, ACINs that have been published, but we did see limited guidance on how to ensure students who miss it in school receive the comprehensive sexual health education in an alternative setting. So overall, implementation of this provision is a bit complex. Well, first, because California is home to close to 1,000 school districts serving over 6 million students. And so while receiving comprehensive sexual health education is mandated for all public and charter school students through TRIA, youth receipt of this education completion is not currently tracked from school to the district or tracked by the Department of Education. That really presents, some challenges for the social worker or probation officer who needs to do this verification. So when I talked to county representatives, most who had implemented this provision they were contacting each youth schools for this verification. Oftentimes, school districts and even schools within the same district are providing comprehensive sexual health education in different grades and different methods and different classes, making it difficult and time-consuming for verification. 2 counties did note that all high schools in their county provided comprehensive sexual health education in health class, and so that could be verified through the transcript. There wasn't a similar strategy that was discussed for middle school, unfortunately. Of the representatives that we spoke with, none had developed a system or procedure for when a youth has missed comprehensive sexual health education. We did find that at least 2 counties are providing this education in their county's independent living programs. 1 county also had a child welfare professional trained as a master trainer for evidence-based curriculum called Making Proud Choices, and it was adapted to for youth in out-of-home care. For our county spotlight, Contra Costa has built a strong partnership with local health plans to really outreach to youth in care to visit their mobile health clinics that are present at many of their middle and high schools. Educators at the school will send invitations to youth in care to visit health educators at the mobile health clinic to receive comprehensive sexual health and reproductive health education on site. And so they've also partnered with CASAS to provide gift cards to youth to also incentivize them to receive comprehensive sexual health education.
Okay, great. Thank you, Carolyn, for that information and for those findings, including the finding from Contra Costa, which it's such a great use of local resources and working to ensure that young people are getting that education in a timely manner. So again, some of the resources that we want to highlight to help implement this aspect of SB 89 are linked again here. You can get those through the handouts and through the slides. But like Carolyn mentioned, there are guidelines for how to enter that a young person has received comprehensive sexual education into the case plan. Both social workers and probation officers need to know how to enter this information, and those requirements are listed here. The next is a link to the all-county letter, where in this all-county letter, there are actually screenshots and directions for how to enter that into the case plan, and how to enter that the youth have been informed about their reproductive and sexual health rights also into the case plan. Again, as I mentioned earlier, in that online training tutorials and videos, there is a link for case documentation where you can watch a video, or you can use this all-county letter and look at the screenshots depending on how you learn best. If you're working with a young person and you notice that they missed their comprehensive sexual health education in middle school or in high school, and you need to find another provider, on our website, we have rosters that are here for you, so you can easily find a provider in your area and arrange for that alternate source provision. It's also good for you to check in, as Carolyn mentioned, that some counties do have that provider of making proud choices, or a trainer, or available resources that might be closer to the youth, for example, at their school. So these rosters are here for you. These are curriculums that are compliant with the California Healthy Youth Act, and so this would qualify. And so here, just go ahead and download those rosters. This makes it very easy for you to link a young person to those needed services and education. And then finally, we also wanted to highlight that we have a previous webinar from 2018 that also talks about this law and lesson learned from the Los Angeles pilot, where they had the Making Proud Choices curriculum, use it as an alternative source. So if you want to learn more about how a county has done that, this webinar will walk you through that if your county is interested in setting up a similar process. So with all of these resources, again, these resources are meant to help implement this law. We still see some gaps in implementation and have some recommendations for how to improve the day-to-day activities that will lead to better health outcomes for youth. So the Department of Social Services, given this legal mandate and the available data and infrastructure and data sharing agreements that they have with the California Department of Education, we believe that in their role of oversight, they can issue guidance about how to verify that young people have gotten this education in their schools through a more streamlined manner with those different districts, since all of the workers, probation officers have to call each school directly to find out. There could be a better way to give this information to the caseworkers that would save some time. The data entry guidance has been issued, but we're not sure if folks have been trained on that. We would like to see unit supervisors running aggregate reports for their units to see if there are any data entry issues, or if everybody's doing that and marking that a young person either has or has not received that education and is scheduling when that education will be provided, as this is, again, one of those things that it really can help a young person make those healthy choices in their life and have the support that they need. So finally, if counties need help with model policies or clarifying the role of social workers or probation officers, particularly we had some questions if a student is graduating under minimum state requirements, do they still need to receive this? And the answer is yes. Likely it would need to come from an alternative source. So with a little bit more guidance from the state about how to streamline this process, I think counties could have an easier time updating their policies and practices. And counties, knowing that we do have the CWS CMS system, can utilize aggregate data, pull reports to measure compliance with the case planning provisions, or get folks to training if they haven't been trained on that, share the materials with them, and make sure overall the whole goal of that is to make sure that young people are accessing the services and education that they need And we now have the data infrastructure to streamline that process and to narrow that down and make sure we're not missing anyone.
All right, so for the last provision of SB 89, it's another case planning documentation one. It requires case plans of youth in care to be updated annually to indicate that the social worker or probation officer has informed the youth of their sexual and reproductive health rights and facilitated access to care information should barriers be present. The rights that need to be discussed include the right to access age-appropriate, medically accurate information about reproductive and sexual health care, their right to consent to sexual and reproductive health services, and his or her confidentiality rights regarding those services, and their right to access reproductive and sexual health services and getting help in getting barriers removed. Case managers need to document identified barriers to sexual and reproductive health information and services, and also how they will assist with removing them as needed. So out of the 5 counties, representatives from 3 counties noted that they had their agency had updated their policies and procedures to specify that caseworkers must inform youth about their sexual and reproductive health rights and remove barriers to service and information. We also found that there were 3 instances where counties modified their case plan management forms or court reports to include documentation of this. You can also see an example for modification in the report. We found that, units with specialized caseloads of older youth tend to be further along in implementation and following the mandates more consistently than units with younger youth. And we also found that, the 5 counties place a large portion of youth out of county. So between 30 to 65 of youth in child welfare placements are out of county, and between 50 to 83% of youth in probation placements are in out-of-home placements. Really kind of making service referrals and barrier removal just slightly more difficult. You can see the breakdown of out-of-county placements in the chart on the slide there. Dependency attorneys and public health nurses also appear to be pretty influential and constructive in advancing the implementation of the case planning provisions. Representatives from 2 counties discussed the active involvement of their public health nurses in engaging with youth about their sexual and reproductive health needs, and was helpful in assisting youth social workers and probation officers with removing barriers to sexual and reproductive health care. One county representative explained that a public health nurse is regularly part of their child family team meetings to offer their expertise in all health-related case planning, including their sexual and reproductive health. Representatives from 3 counties discussed dependency attorneys playing a strong accountability role for SB 89. One unit supervisor explained that really the attorneys provided the legal impetus to ensure that sexual and reproductive health was part of the case planning. And they needed to move forward with ensuring compliance with SB 89 before the agency set forth official policy. So while not all counties had updated their policies to indicate that this provision is a mandate, representatives from all counties were aware of the duty to inform youth of their sexual and reproductive health rights, and noted that, along with the full Bill of Rights, they were being reviewed with youth on their caseloads. Documentation of these conversations, however, is happening on an ad hoc basis depending on supervisor oversight and direction. Representatives from all counties discussed distributing the CDSS youth brochure that Anna talked about earlier, that outlines the sexual and reproductive health rights to youth in care. This again emphasizes that resources created by the state are helpful in driving implementation progress. 2 counties, one of which I'm about to highlight in the next slide, noted that they had developed sexual and reproductive health rights brochures tailored for their local area. And so, yeah, for the county spotlight, we're highlighting Santa Clara. They had created a sexual and reproductive health brochure that is tailored to the local area. So, highlighted resources can be easily accessible for youth. In the report, you'll be able to see the full brochure and a link to see it in full size and be able to read what it says. Santa Clara also convenes collaborative monthly meetings with partners like First Five, Planned Parenthood, public health nurses, and others to really discuss, available resources for service referrals, upcoming campaigns for their medical hubs, and strategize on what they can do to best support parenting youth.
Great. And again, that report that is being referenced is in the handout section. You can see that brochure kind of to scale in the appendix of that report. And again, we do have these resources that are here to help implement this aspect of SB 89. And these are the resources we think will best get your conversation started on rights and service and barriers that then can lead to more fine-tuned county practices like the County Spotlight from Santa Clara. And it's really helpful when counties do this and highlight their local resources and make it publicly available, because as we mentioned earlier, we've got a lot of our young people who are placed out of county and in other counties. And so the better we can collaborate, know about existing resources, work with public health nurses and dependency attorneys with these resources, we're going to have greater access to care and timely care. So here is the guide that there were some questions about, can we see that guide? Here is the link. This works as well for probation. The department has also a similar guide for STRTPs. Reviewing these materials before or after having a conversation with a young person about their sexual and reproductive health rights and services will help make your conversation easier, more open, more knowledgeable, with less judgment towards the youth, and will help you direct them to the health providers who do have those more detailed answers. So this is that guide. That's how to have those conversations and get that going. Again, as we mentioned before, here is the brochure. Post it, share it, social media it, do what you need to do to get this out, and familiarize yourself with it. The best way that we can improve health outcomes for young people is by knowing their rights, having the information ourselves so that we can help ensure those rights are being upheld with the young people that we serve. On our website, which is linked here, there are these age-appropriate conversation starters for case managers and for adults who are working with young people. They are in English and Spanish, and they're by age level. So you can see that we have for younger, early adolescents, middle adolescents, and transition age youth. Those conversations do sound different based on the development of the child, based on the age of the child and what's going on with their bodies and socially as well. So these are here for you as a conversation starter. Please feel free to download and disseminate those and use them. And again, we have this webinar from May that actually is a deeper dive into some of those medically accurate tools that you can use. All of these resources are designed for you to use, adults who work with youth, to help have these conversations in a healthy way. And again, just while you may not be a health provider, you can provide medically sound information that is trustworthy. And here, these slides, these fact sheets are all here for you to, if you take some time to get to know these resources, it'll be faster recall for you to use in the field. So given that we know there are barriers to accessing care, both because people may not know what services there are available, who to call, how to get young people there, what does timely mean, how to get help from public health nurses, how to get help from the case manager in setting up those appointments or coordinating with the caregiver to make sure that the young person gets there. We do think that CDSS, and because we have Medicaid coverage until age 26 for youth in care, and we have all of these free materials on youth rights, that CDSS, in their role of oversight, can send out better guidance, instructions for how to record when a caseworker informs a youth of their rights is something that we showed to you earlier. Circulate the Office of the Foster Care Ombudsperson's findings around sexual and reproductive health rights, as is required in a number of laws. Issue guidance discussing typical barriers to sexual and reproductive health care and how you can help to remove those barriers with specific examples and strategies for barrier removal. We really believe a cross-county work group with the purposes of sharing resources, promising policies, and practice will assist with this implementation effort. In our questions panel, we did have the question, are any of these 5 counties willing to share their policies and procedures? Can we see what LA did from that pilot? The answer to this is yes, and counties like to learn from each other, so having the state convene that kind of technical assistance and community would really help to implement this. Again, we think that counties can better ensure that young people are getting to the appointments that they need, that they're aware of their rights by documenting and including barriers and barrier removal in the court report itself, by engaging with the public health nurses to assist with informing use of their rights from a medically trained perspective and in help removing barriers to sexual and reproductive health care. Publicly post and cross-communicate those resources that are available for youth in their county. And if a barrier persists or a needed service does not exist within the county, that counties can provide transportation to the nearest available service and make sure that a young person does have timely care. Okay, so now that we've talked about the provisions of SB 89, how counties are working to implement this, the resources that are available, and our recommendations for next steps in improving the health outcomes of youth, we want to talk about what can we do next. So we do have the report. If you can help us in our community by downloading the report, discussing the findings with the folks and young people that you work with, and how to use this information to better serve your community, and keep the conversation going with us. We are here to help. Identify ways that you can address these issues and facilitate progress on implementing these laws. As we saw, not every county has yet implemented all of the provisions. It's a work in progress, and how can we get there faster so that youth are supported in their healthy outcomes. And SDRTPs and transitioning group homes, if you're on the call or if you work closely with those partners, we are having a learning community where we're going to actually assist in providing trainings and technical assistance to SDRTPs and transitioning group homes around sexual and reproductive health rights, services, and care, and how what is the role of SDRTPs as caregiver in upholding those services and rights. And if anyone is interested in joining this learning community, you can learn more by following this link here or by talking to me. We'll be starting that in March, and we're asking folks to let us know if they would like to be a part of that by the middle of this month, so that we can start planning around the needs of those facilities in the learning community. And finally, I do have a number of questions in the panel. If you can take some moments to send us your questions, we will follow up. And again, thank you so much for being here with us on the call today, on the webinar, and for all of your work with young people. Everything that you do to enhance the quality of their health and in their lives is really making a difference, and we're happy to partner with you in implementing this law. So I'll just go through some of the questions I've received. And again, before you log off today, just really make sure to download these slides, as all of the links are contained there, including to the report. So one comment that I received was that someone really likes the idea of a guide for social workers, which we did point out is in the slide. I believe that is slide 53. It's also on our website and the Healthy Sexual Development website. Again, we talked about is anyone willing to share their policies and procedures? If you email us, we can identify which policies and procedure you're interested in seeing and make those connections so that you can get the information you need to work on your county or local policies. One question talks about the California Healthy Youth Act allows for an opt-out process if a parent does not want their child to receive sexual health education. And does SB 89 allow for a parent to opt out of, or does SB 89 require this education even if a parent wants to opt out? So that's a good question. And what the law says is that this education is mandatory for young people, that they must receive it once in middle school and once in high school. And so if not through the school's curriculum, through another compliant curriculum. There were questions again about how do we access these resources. The links are all in the PowerPoint. There were some questions. Does the CalSWEC online training satisfy the training requirement for social workers as opposed to attending the classroom training? So that's a good question. Carolyn, do you want to answer that one?
It does.
Oh, great. That's the answer. So yes, so I think that was from Ventura Cortez. If you're still on the webinar, the answer is yes. So feel free to use that if that works better for you or if the classroom training is too far away. I know that basically the difference is the classroom training, I think, is more in depth, more time to learn, and not everybody likes learning online. Some people like learning together. So there's different styles, learning modalities. So use what works best for you and for the young people that you serve. Let's see, next question is, I gotta adjust my panel here, 1 second, everybody. How do you balance a youth's right to confidentiality versus full disclosure to the resource family approval caregiver if you have a youth who is HIV positive? I would like to direct to the best resource to that. So what I would like to do is talk with Carolyn about sending that out in a follow-up email so that you all have the answer to that question. There are some resource information on confidentiality and on the rights of the young person to privacy, and then as well as the safety considerations. So we want to make sure that you have that technical resource provided. Another question is, how does SB 89 affect youth that end up moving out of the state? And so for youth who are not in California, they still have the requirement of monthly visits from social workers or probation officers who are the case managers. And they should still be checking in with the young person, informing them of their rights, helping them get access to services, and modify that in the case plan. So it pretty much all pertains to that. The state that they may be placed in might not have the California Healthy Youth Act, and so they may or may not have a school that does provide these curriculums, which means that there would have to be coordination to find an alternate source of comprehensive sexual health education. Another question was, how should case managers document in the case plan for youth who are nonverbal due to a medical or development diagnosis? So this is a really good question. I think that it would be great for the case managers to work with a public health nurse and with the medical professionals to deliver this information in a way that is age and developmentally appropriate, which there are specific medical tools and resources to allow people to do that in a way, especially for young people who are nonverbal. So that is a really specialized example, but there are resources available, and working with the case manager and the medical professionals to make that happen, and then to document that that has happened. Okay, let's see. I'm getting more questions, so I'm just scrolling. Give me 1 second. Okay, this is more of a comment, but I wanted to share it, so there's a longer comment. So it says, I think a large issue with sexual reproductive health is that a large population have experienced sexual abuse. And because we are creatures of behavior, these issues of childhood abuse carry on into adulthood, meaning there can be behavioral adaptations that have never been addressed. So all of this is added to the fact that these children are trying to compensate for lack of human connection. So I think, to me, that's more of a generalization, but to talk about the idea that people have experienced sexual abuse, that may be one of the reasons why they've come into care, that being in care or in certain settings themselves put young people at greater risk for sexual abuse than once they're in care, that this is definitely a part of the conversation. Part of this conversation about why we have, for different age groups, those materials. All of these materials and conversations talk about things that are, what are healthy relationships, and that also means what is not, so that young people know that if something did happen, that they can go and talk to people, have appropriate access to sexual and reproductive health care if they were at risk of heightened sort of sexually risky behaviors that are sometimes associated with history of sexual abuse, getting them to those service providers to provide that necessary counseling, testing, treatment, and have it be confidential and sensitive is, again, why we need our caregivers and caseworkers to have these resources, to get them there timely, and to make sure that we aren't waiting a number of years. We have to be proactive when we know in our society that sexual abuse has been a cyclical, generational experience for many of us, that we do need it to be addressed. That's why having these really bold, medically informed conversations is such a huge part of dismantling that, which was the end of this comment in question, is, you know, how do we address improving sexual health overall when we do see sexual abuse in society at large. So thank you for that comment. And again, thank you. You know, when I say thank you for everything that you do to work with young people, this is why, because it is a form of healing to have folks access this type of care. It is a form of health to have folks access counseling and care, and to know their rights, and to have knowledge about their bodies and about their about sexual development in the body. And all of this is a way to work on that as a whole. So thank you. Another question was that, is the document titled Report Final available on a website? I'm able to access all the other handouts, but not able to open this specific document. So as a follow-up to this webinar, for everyone who's registered, we will include the report itself so that you can have that. So thanks for flagging that. Another question was that, is there any data on differences or distinctions between LGBTQ foster youth and non-LGBTQ foster youth, which we do have, so we'll send a link to that as well. It's linked in the PowerPoint, but we'll also just reference from our website where we do have fact sheets about the various health disparities. There's another comment here about observed and diagnosed pregnancy status is documented in specific fields in CWS CMS. Is there any concern or guidance with such also being documented in CWS CMS context as a caseworker supports youth with this? Yeah, there are specific guidelines around confidentiality and who can see and be told what information. Carolyn, I don't know if you want to add anything to that, or we can just include a link or to this information. Let me see, what other questions do we have? Just a few more questions here, so thanks to everyone still hanging on to the webinar. Could you review the different funding streams and budget line item descriptions available to support this work? So what we will do is we can share the bill text, which is part of our SB 89 webpage that talks about the funding that's available. Most of that funding was used to develop the curriculum and to get those resources out and available and for the development of the resources. And Carolyn, did you want to add anything about the funding? We're kind of running out of time, so most of my answers are going to be like, let's send you the information or email us directly to continue the conversation. So just 2 more questions before we wrap up. One is ways to respond to a caseworker who is not informed about the transgender community using a young person's correct pronouns and name and terminology. So this is a really good question. There are standards around cultural competency and identity, around sexual orientation, gender identity, and expression. And there's also trainings on sexual orientation, gender identity, and expression called SOGI trainings. So the practice is to have a non-biased, a non-judgmental, gender-affirming response and care for young people, which means absolutely knowing how they identify, what pronouns they prefer, and to use those names and terminology in conversations and in conversations with medical professionals to make sure that they receive gender-affirming care. There are tools and resources to receive gender-affirming care and to reassure that. And if you're talking with a young person who's expressing any discrimination about their identity as trans, to help report that to the right complaint center, whether there is a medical provider or other, because this is their right. They should have their rights enforced. They should be able to live in a safe place with their gender affirmed. And that's why we do have the rights brochure. That's why we do have complaint systems to improve this practice where we know there is active discrimination, particularly against this population that is not helping us, and we need to make sure that youth are protected and safe and valued and affirmed. The next question is, what are some examples of probation departments in the state, how they are implementing this training and quality assurance to verify that schools are providing the CSE information to foster care youth in the juvenile justice system? Those questions, I believe, are answered in the report itself, because Carolyn had interviewed probation departments from the 5 counties. And so we talk about this in the case documentation section of the report. And if you want to follow up with any questions after looking at that report, please feel free to email us. And our emails are both in the slide deck here and in the report itself to keep the conversation going. And we're happy to also connect anyone with we can reach out to the probation interviewees and see if they would be willing, again, to have that cross-county collaboration or in-county collaboration as well. And finally, where can this webinar recording and attachments be found after today's webinar? So on the John Burton Advocates for Youth website, we have a past trainings page where this will be posted, and we'll also email it to you once we wrap up. So I believe I have now gone through all of the questions. Thank you all so very much. I hope I, have said that enough to you, and you feel the warmth emanating from both Carolyn and I to everyone who participated in this report, everyone who's working with young people to ensure and affirm their care and to implement this law. We know it will make a difference in the lives of the youth that we serve, and we can't thank you enough.